So I started my career at the Mayo Clinic. I did my training there, fellowship, and then was appointed assistant professor in the Department of Neurology there. Loved that experience. Had an opportunity to do some research of my interest. And then I left around 2000 and I joined Boston Scientific. I was based out of the Maple Grove office here in Minnesota. And my role there was part of the business development team. At this time, Boston was experiencing tremendous growth and innovation, primarily in the drug-eluting stents. And they were looking to expand their footprint outside of interventional cardiology. So again, I had the good fortune to be a part of a team that was looking at emerging technologies, really disruptive stuff outside of the traditional endovascular technologies that they had, already developed. So that was really my first foray into industry. Before, I'd always been in kind of academic medical environments. That gave me an opportunity to continue to scratch that curious itch that I always had. As a researcher, you have that. But it also exposed me to how products are made, how they are developed through the various rigors of the FDA, how you think about marketing them, what is your go-to-market plan, how do you build a sales channel, all of those discrete steps that you need to think about and plan and execute on. I had never done, was exposed to it, and was tremendously excited about it. The energy, of taking something from the back of a napkin and developing it and going through iterations and the successes and the failures and the fits and the starts. That part of product development was tremendously exciting to me. So while I was not involved in any of those directly, I had a chance to see how that was played out by the fact of evaluating and being involved in some of these companies that we were interested in to eventually invest or acquire. And then I think that was the entrepreneurial match that was lit in me. And then my first technology that I really started, or company that I started, was OrthoCor. So on independent research, I came across a whole host of sciences on magnetic fields. And what they do is they perturb, either favorably or unfavorably, they perturb the cell membrane. All of us have cells and all of us have membranes that encapsulate the cells. And they're different depending on the type of tissue, whether it's bone or blood or dermis or brain, and many others. So from a very, I would say, general statement, and there are exceptions to any general statements, and there are exceptions about what I'm about to share. But in a general statement, if you can influence the cell membranes, and the cell membranes not only protect the cells, but they can elicit a signal. In the biochemistry world, this is called second messengers. If you can influence these second messengers, you can tell the cell to do something, to make a certain protein, to act in a certain way. You can also, by providing magnetic fields, increase blood flow. And I appreciate it in many of these areas where you have a disease condition. The problem might be improved or hindered by blood flow, right? In some places, you don't want blood flow in the event that you have a bleeding, such as a hemorrhagic stroke. You don't want to bring more blood flow there, right? But in areas where you don't have good cell turnover, you want to bring more blood flow there. So one of the areas I was intrigued at was cartilage. And why is it that cartilage or any type of connective tissue, so cartilage in your joints, tendons that are involved in your joints as well, and ligaments, right? So those three kind of big buckets, they all, while they may look different and they do different things, one of the common themes they have is they don't have a lot of blood flow. And there's not a lot of turnover in the cellular function, right? That's good because it provides stability. It's bad because when you have an injury, whether it's your cartilage through degradation, whether it's your tendon and ligaments through a tear, right? Let's say it's overuse injury. In any of those cases, if you have an injury, because the environment that they've been programmed to, they don't have a lot of blood flow. It's very difficult for the body to heal itself. I would submit to you the body's probably the best healer, the best source of repairing itself. So I go back to the ability of magnetic fields that you can't feel, right? You appreciate some component of it, but it's not as if your temperature rises or you have a sensation when a magnetic field, at least a therapeutic magnetic field, is applied to you. But what if you could put a magnetic field to bring in blood flow to an area that doesn't have blood flow? And what if this could be done to help repair and remodel that tissue? So I thought about cartilage. And the science of magnetic field, specifically pulsed magnetic field, where it's not constant, it's an on-off, and the amplitude and frequency can be manipulated. But what if that could be put to cartilage to essentially shock the system? And I'm using that word broadly, but to stimulate that environment to do something different. And that something different is bring more blood flow, and for the cells that deposit cartilage to ramp up, to put more cartilage, to start producing more cartilage, to repair an area that had been degraded, right? So that was the broad thinking. What if you could do that? So there is science out there on magnetic fields, published science, peer-reviewed, that it can have this effect depending on the target tissue. It can bring more blood flow, it can increase the cells that you're influencing to put more proteins that they're already programmed to do. But then how do you put it into something that is usable? At that time, things have changed now, but going back many years when this was developed, there are portable handheld devices that give the magnetic field. But in the case that we initially thought of, the initial use case was, for example, arthritis in the knees. And the arthritis in the knees, there are many contributors. One of the earlier contributors is this degradation of cartilage, right? Where you don't have a nice surface on both aspects at the joint of the knee, and that contributes to the pain. So what if you could wear a wearable brace, and that brace obviously gives you some comfort to the knee, and what if you could deliver some device that you could put in, that you can control as a person, and you would put in or slide in onto that brace, and it delivered this pulsed electromagnetic field stimulation. And you could wear it. And then you could wear it for however long you want to wear it. So you have the option, you have the control, right? That was the initial approach of this. And then we added, well, if someone's going to wear it, you'd want to see if you can add something else that could be an additional added benefit. And that additional added benefit is heat. Right? Heat per se is not going to have a sustainable effect in terms of the remodeling, right? So we knew that that wasn't going to be clinically meaningful, but it would be appreciated by the patient as being that warming effect would be positive, right? For them to encourage to continue to wear the brace, and then you have the electromagnetic field stimulation. All of those things were really the initial components of this. How do you have a brace that somebody would wear comfortably? How would you have heat that would give kind of a rewarding effect to it? But then how would you be able to deliver in a portable way and in an inexpensive way this pulsed electromagnetic field stimulation? That was really the initial building blocks of the technology that became the OrthoCor brand of products.